Not moving much. Yes.
What a bypass. Dr. Kanchan, you are live. Please proceed.
Okay. Shall I start?
Yes, please. Good afternoon.
Okay. So today I'm going to speak about the technique of PRP preparation and quality control. Okay. As all we know, one of the osteoarthritis disease is very common in the whole world, not only India. And you know, all races are equally more than women than man affected 50, and most of us our 60 and 17 years. And always know osteoarthritis can occur any joint like shoulder, spine, hand, hip, finger, knee, and feet. So before to speak about the PRP, first would like to tell you one of the molecular region that can initiate the osteoarthritis. You know, in the chondrocyte, there's a lot of the 10-alpha receptor. They bind to the 10-alpha receptor, then IL bind to IL receptor. They start the sending the bad signal in the chondrocyte. Then the chondrocyte, they start the formation of metalloproteinase. Then start the degradation of the cartilage. These are one of the molecular region for the osteoarthritis. There are other region also. So this figure you can see that this is the healthy knee and osteoarthritis knee. So you know, for the osteoarthritis, we have the lot of the treatment and even knee replacement, but there is some sometimes knee replacement not feasible or desirable due to various region. So when all else fail to improve the pain, so what is the other alternative therapy for the knee replacement, other thing? So the other alternative therapy for the knee replacement, as we know, first the recombinant gene therapy. This is synthesize the growth factor which promote new cartilage. Also the specific growth factor that promote the cartilage and maintain the
Your PPT is not visible. Can you just change it?
Hello.
Your PPT is not visible.
My PPT is not visible.
Yes. Just exit and reshare. Yes. Just make it as a PowerPoint slide now.
No visible.
Yeah, now it is visible. Can you make it into a slideshow?
I don't know when the for the presentation mode is not visible.
Yeah, just can you try once again?
I think I will try one. Otherwise, we'll give that mode only. Now visible. Not visible. So okay, I give this mode only. That okay, no problem. There is some function in this mode I can't do for the presentation. Anyway, I think now we can go. So I'm talking about the alternative for the knee replacement. One of the recombinant gene therapy. Second is specific growth factor. Last but not least, platelet plasma. Recombinant gene therapy is occur. It's very costly. Sometimes work, sometimes not work. Again, same problem with specific growth factor. But last is not the platelet plasma. You know, is the platelet plasma? Why platelet plasma? You know, first is the 100% safe. PRP therapy use platelet harvested from the patient's own blood. This therapy ensures no risk for disease transmission or injection, allergic reaction or injection. This means PRP therapy can be performed everyone, right? Second, PRP is very convenient, we all know. And third is PRP is a natural, right? It's not by allogenic. The patient body does not feel any sense of violence for the foreign body by using their own harvested platelet, right? Or fourth is cost effective. This is very important. So first, what the goal of the PRP treatment? It's like the PRP treatment, it's a biologic treatment, is to make your life better by the relieving pain, by the enhancing the healing process, by the increasing the motion and improving in strength. See, like, so what the PRP therapy, how to make PRP means how to make high quality platelet-rich plasma for the best result from the PRP therapy, right? How to make the good PRP. This is the main region. So this is my publication available on the online PubMed. We spend more than 2 years to standardize the good method to preparation of PRP, activation of PRP, time of PRP, temperature of PRP. So we conclude, in the last we conclude very good method to make your laboratory in your lab with the only help of the centrifugation, you can make very good PRP, right? So as you know, is as in naturally our body, there's a 93% RBC, 6% platelet, and 1% WBC. But in PRP, platelet plasma, there is a 95% platelet and plasma, and 5% only RBC. This is the very important. So PRP means plasma with platelet concentration above the baseline value are referred as a PRP. It's the PRP definition. So platelets concentration must be above the baseline, right? So how to make the high platelet recovery rate, right? If you are making the PRP, this means you have to method recover high platelet concentration, right? So this is a very important. Anybody want to make the PRP, whether you're going by the manually, centrifugation, by in laboratory, by your own way, either going to use that already many kit are available in the market, you have to count pre-count, post-count. This is the very good QC for the you making the PRP, right? Pre-count means before to start the making of PRP, what the platelet concentration per molecule in the blood. Again, after the making the PRP, again you have the post-count. So normal concentration of the platelet in the body and pre-count 1 lakh per microliter. Okay, but after making the PRP, it must be about more than 5-fold. It's 10 lakh per microliter, right? If you don't count the pre-count, post-count, you're not sure what you have to make the PRP. Really, they have the 5% percentage concentration or not, right? So PRP considered 94% platelet, right? Red blood cell about the 5% and white blood cell about the 1%. So pre-count, post-count very important. So for the PRP preparation, simple 3 method for the sample collection. You can collect the sample in a tube from the patient, and the centrifugation process, then storage process. So I will let you know detail one by one. PRP sample collection, you can collect the sample in ADTA, CDDA. But in my laboratory, what I standardize and what I conclude, the ACDA is the good for the PRP yield and superior platelet concentration and activation morphology compared with the other. Right, but in contrast, growth factor concentration do not differ depending on whether you collect the ATA, SADA, or the sodium citrate. But it's better to collect blood for the PRP, SADA for the superior platelet concentration activation. Right. So optimal centrifugation speed and temperature duration, right? So it's very important. If you're going to make the PRP in your laboratory by the centrifugation method, you have to, it's better to have swing out centrifugation. That's the good, you can get the good platelet of the PRP. And temperature, that's very important. Temperatures either 20 to 24 degrees centigrade, but also in my laboratory, what I found 12 to 16 degrees centigrade may improve the platelet recovery and viability, right? So what I can try 12 degrees centigrade or 60 degrees centigrade of centrifuge temperature is the optimum temperature, right? Also, there is a many kit available. There are many people. There's single, double centrifugation for the making the PRP. I recommend double centrifugation always better to increase the platelet concentration and decrease the leukocyte and RBC concentration. So double centrifugation is very important. This is the very important. Do not chill your blood anytime before or during platelet separation. So don't keep blood after collecting the 4 degree. Yeah, after making the PRP in the 4 degree. So don't chill. This is very important. So centrifugation process is very important, but you know, this PRP going to inject some human body, so must be do in the GLP laboratory, it must be sterile and without latching the platelet so that they can actively secrete the maximum growth factor. Don't use maximum centrifugation speed. You have to standardize in the laboratory what the good speed for the centrifugation. What in my laboratory I standardized and I found we started many methods. In the last, we conclude there are two methods. First method, we recommended 100G, like this. So there are dual centrifugation. First, the soft spin, then hot spin. Soft spin is 100G for 10 minutes, then followed by the hot spin 400G for 10 minutes. This is optimal. This yield is 5% increase the platelet concentration and preserve the platelet integrity. Again, second method also good. That is the 160G for 10 minutes, followed by the hard spin 225G for 15 minutes. Because it depends upon the some centrifugation, they don't have high speed, so you can 250G, but some centrifugation they have the high speed. You can go more than 400G or more than 500G. So first method is a very good. If you have limitation in your centrifugation speed, then you can second method. So these all the method are very good. We have already standardized our laboratory for the maximum recovery of the platelet. So during the centrifugation, RBC come the bottom layer because their specific gravity 1.09. Platelet poor plasma in the top layer because their specific gravity 1.03. Platelet concentrate, this is the middle layer because their specific gravity 1.06. Right. This is the inside the centrifugation going on, because you must know the mechanism why they are different layer. So there are two types of PRP people making the PRP rich, platelet rich plasma. Some people also join the leukocyte rich PRP. So how you make the platelet rich plasma and how you to make the leukocyte rich PRP. After first centrifugation, that we used to say the soft speed. RBC come in the borderline. This is the buffet coat. Then upper port is a platelet poor plasma. Upper of the buffet coat, there's a platelet rich plasma, right? If you want to pure platelet rich plasma, you have to discard this platelet poor plasma. You have to clear this platelet rich plasma, and above of this buffet coat. This will be for the platelet pure plasma. Then do the second centrifugation, right? Again, if you want to look at rich leukocyte rich plasma after first centrifugation, you have to collect this buffet coat from this side and from this portion. Then it is build the leukocyte rich plasma. Then you go for the second speed that I already explained the earlier slide. So this is a just graphical method, graphical figure. You can understand more easily. This is you can collect the blood, where amount you want to take the PRP. This is one very good question. What is the good ratio making the PRP? Anybody can guess? Suppose I need 1 ml PRP, right? For the some work, so what ml of blood we have to collect from the patient, right? This is a very good ratio. We have to optimize in our laboratory. Generally, for the 1 ml PRP, you need 10 ml blood. Right. Suppose you need 2 ml PRP, you have to collect a 20 ml blood from the patient. If you want to 5 ml PRP, you have to collect 50 ml blood from the patient. It's also dependent on the patient have normal concentration, normal ratio of the platelet in their body. Otherwise, you have to manipulate. So for the suppose you need 4 ml PRP, you have to collect 40 ml blood. Then first spin, that is to soft spin. First spin only for the remove the mostly this RBC. Then all this poor plasma and platelet rich plasma transfer in the second tube. When second hot spin, then you can make this PRP. This is ready use for the depend upon the new what ml of PRP you needed, depending upon what ml of blood you collected, you can do it. So after making the PRP, the storage condition of platelet rich plasma. Temperature in the best practice, the storing platelet rich plasma room temperature. Adequate. Don't keep in the 4 degree. Room temperature means if you have the in laboratory, if you have the AC is okay, so you can keep. And time. what we have taken, we have measured the PRP should be used generally within 8 hours after centrifugation, as this maintain the leukocyte concentration and pH of the PRP. But however, PRP can safely store 24-hour room temperature without affecting platelet count or activation. But it's always better to use the after making the PRP as soon as possible, because storage longer time, there is a chance of the contamination, right? So, but within 8 hours is quietly very good. Delivery of PRP. Generally, people without activation, people are using PRP, but evidence according to publication is must be activated, because without activation PRP, there's a platelet concentrations, growth factor is very low, so must be activated. So you can activate your PRP by the collagen, thrombin, calcium chloride. So there is a two method to activate platelet plasma. First is the exogenous. You have to add something from the outside like collagen, thrombin, calcium chloride. Second is endogenous. You not need to add anything from the outside in the PRP to activate it. You can. Endogenous means just you have to play by the cold shock. You give the cold shock. That have already standardized in our laboratory. That is a good activation method. So why activation required? You know, there is a in the platelet there is a two granule, dense granule, alpha granule. This granule must be pop up, because this granule contain all the growth factor cytokine. They have pop up. That's then all the growth factor cytokine will reach. Otherwise not. That's why activation is very important step of the making the PRP. You know, alpha granule, they contain the many growth factors, some of the like TGF, transformer growth factor, vascular endothelial growth factors, growth factor, platelet derived growth factor, endothelial growth factor, many more. This all growth factor acute inflammation leading to collagen deposition and enhance the tissue repair. Same thing, dense granule, they contain the factor that promote the platelet aggregation. They contain ionized calcium. Dense granule contain the serotonin. It is an important chemical and neurotransmitter. All together enhance tissue repair. So everybody know platelet-rich plasma growth factor increase linearly with platelet concentration, right? As platelet concentration go high, at growth factor go high. So that's why your PRP must be have the good amount of the platelet. How you have to know your PRP have the good amount of the platelet or not? You have to count, pre-count, post-count. You have to by the cell counter. Then you can understand. Otherwise, there will be problem. So how does PRP work? You know, platelet are rich source of growth factor cytokine. We know bioactive material. So the exogenous induction of the growth factor enhancing tissue healing and compromise situation. This all the thing. Again, you know, these are the growth factors. You can see this slide. They have all the growth factor have some other work, other like platelet derived growth factor. They important for the cell growth. They important for new regeneration, repair, blood vessel, collagen production. Then again, endothelial growth factor. They are important for promotion of endothelial cell growth, angiogenesis, very important, angiogenesis, and promotion the wound healing. So these all growth factors have different role, right? Like insulin like growth factor, I1, I2, they regulate cell growth. So all growth factor very important. This all growth factor is do the angiogenesis, collagen, and biosynthesis. So growth factor very important. If you want to maximum growth factor, you have to your PRP maximum platelet count at least more than 5-fold, right? People are asking in the platelet, what about the RBC and WBC, right? Whether WBC is good for the PRP or not. As we know, white blood cell are the source of the vascular endothelial growth factor. It is a potent stimulator of the angiogenesis. And leukocyte also provide the anti-infectious environment, regulate immunity, so to release the oxygen-free radical, decrease the wound infection rate, and do not affect the outcome of PRP used in joint surgery. At least joint surgery is not problem. But depend also where you're going to use it is depend upon the you. If you choice, if you want to leukocyte, you can make the leukocyte rich PRP and leukocyte poor PRP. It depend upon the choice. But again, popular, what the advantage, disadvantage? If white blood cell are much more. Disadvantage is secretion of the pro-inflammatory cytokines such as the MMP, serine, protease, oxygen radical, and this is a neutrophil trigger the increase the tissue matrix degradation. Pro-inflammatory WBC fraction might inhibit the healing process, and this also maximum white blood cell they increase the localized pain. But what is the advantage? WBC fraction are essential for wound healing. We all know this have the interbacterial effect. So it seems desirable amount of the low amount of WBC or RBC is okay for the PRP. During the making the PRP, you can make what you want. So that is the thing. So how does PRP work to heal the knee? As earlier, the earlier slide, I think starting slide, I told you what the mechanism, molecular mechanism osteoarthritis occur. Again, PRP, one of the mechanism, this impacted plasma, a lot of the TNF-alpha receptor, I1 receptor, they bind TNF-alpha and insoluble TNF-alpha and soluble in antagonistic I1. They bind on TNF-alpha receptor, they bind on I1 receptor. They stop the sending the bad signaling. They stop the bad signaling, stop it, then stop the producing the metal protein formation. Then stop the degeneration of the chondrocytes, right? Again, this growth factor, the platelet have the growth factor like PDGF, TGF, insulin growth factor. They increase the synovial fluid fibroblast and hyaluronic acid production. They again increase the bone regeneration, bone formation, collagen deposition, proliferation of the osteoblast, and they decrease the osteoclast formation, right? So they have the loud growth factor, or they make much more matrix more resistant to the enzyme degradation, all the things. So these are the make the regenerate the tissue and cartilage. These are the one of the mechanism for the that how the PRP working. So meaning people asking with the PRP is a carcinogenesis. So I told no growth factor because PRP they have only growth factor. Growth factor act on the cell surface receptor only. They do not enter the cell, do not cause the DNA mutation. No possible mechanism by which growth factor would result in neoplastic development. So no report till this literature the PRP is a carcinogenesis or not. Because growth factor only can activate certain gene activation. So do not worry about the PRP is safe for the uses, right? Also very important, PRP does contain stem cell because there are many kits available in the market. I'm not going to tell the name. They saying their kit, they also doing the PRP, they also harvest the stem cell. No, PRP does not contain stem cell of any relevance. PRP means you going to collect the peripheral blood. In our peripheral blood, there are no stem cell. If you want to stem cell in the our peripheral blood, you have to inject some inject hormone injection from bone marrow. This stem cell come in the peripheral blood. So PRP does not contain stem cell any reference, but they direct the resident stem cell, right? Also, PRP accumulate and replicate the MSC side of the PRP injection. That they recruit the MSC, right? But PRP alone, they not contain the stem cell by any method, right? How many treatment needed? It depends upon the disease of the grade, right? Or it's depend upon the physician. They can tell how many treatment needed. Generally, 2 to 3 treatment is important for the regeneration. At least 2 doses is important for good regeneration. And so in the last, I conclude PRP is without surgery, right? So very important. There's no need to go for surgery. Same day you can take PRP, OPD come in your house. It autologous safe. No need to worry. Low cost procedure, free to side effect. Target specific. Very important. Target specific. People saying the PRP don't have any mechanism. They have no mechanism, molecular mechanism. Or relieve pain, right? So take away message, although PRP show the promising patient outcome result, however, it is found that there is no standardization in the PRP production method, neither the number, timing, volume, application. That the full potential of PRP indication and application has yet to be determined. That's why we spend a lot of the time in our laboratory to spend to make the good PRP. And now we have the standardized the method to make the how make the good PRP with the maximum count of platelet. And now we're going to do the clinical trial of this method because with this method we can recover more than 5% of platelet. So then it will come the good result if we publish the paper. Then so anyway, so this is the Modi ji. They are in Guardian Institute, but that time he was CM only. We are very fortunate. He have inaugurated out the institute. This is our laboratory. This is me. This is my some research publication, but I cannot show here because it's not going to presentation mode. Anyway, thank you. Thank you very much. Or sorry, Ravi, I could not come at your place due to some region, but really I'm very happy to hear to give my lecture for your national conference. I hope my slide and my presentation make some add some contribute some technique, yeah, some information that might will help you all the people. Thank you so much.
Sir, thank you so much, sir.
Yeah, if people have any question, I can answer them.
Yes, of course, sir. Any questions from the audience? Sir, is there any possibility to quantify the growth factors before injection?
Yeah,
Clinically.
you can read my paper. Na? We have the quantify the growth factor by the ELISA method, cytokine, all the thing. We have done all the thing. This is my paper published, and you can see the in the PubMed. That's why we say the really how do you know the growth factors as they are not? You have to quantify. We already quantified by the ELISA method. So there is ELISA, you can quantify it. There is a already antigen and antibody available in the market. You can do ELISA in your laboratory. For the reference, you can go through my paper.
Sure, sir.
Sir, Dr. Ravi, thank you very much for coming to the
Okay. I'm not hearing.
Antimicrobial property.
Question. I'm not able to hear.
Sir,
sound here.
is platelet having any antimicrobial property role, sir? Is it acting against any microbial?
Yeah,
If we
because
have-
here there is a
Can
many
we
paper.
inject PRP. That is the major question, sir. Actually, if the site is injected and if you are planning for an PRP injection, can we do with the procedure, or we have to wait for it to heal and then inject?
You want to the PRP have the antimicrobial property or not, right?
Yes, sir.
Yeah, PRP have the antimicrobial property because there's a lot of the paper always. Also, we going to do the we have already project in our intermediate project to see their invasion rate in the particular bacteria. But according to publication, this platelet have the antimicrobial activity. Also, if you platelet have some WBC, you know WBC is the good for the antimicrobial thing. But platelet alone, they have antimicrobial property. There is a many published paper, and also we going to do this experiment in our laboratory, so we can see our eyes with our eyes in our laboratory. But they have property. Yeah.
Okay, sir. Thank you, sir. If there are no more questions, I think we can just you have.
Okay.
Sir, is there
Thank you. Thank you, Dr. Nitesh
one
Prabhu.
more
Sorry, I bother you the last time, in the last minute. But thank you. You make this my presentation here. So thank you very much. Thank you. Yeah.
Thank you, sir. Thank you so much.
Yeah.